Donald.
Here now is Howard Sandow. Howard's a ICU nurse at a hospital in Brooklyn, New York, and also a special representative with the Federation of Nurses. We're not saying, Howard, which hospital you work at, but obviously if it's in New York City, it's one of the busy ones. We hear David's report there about how terrible things are on the one hand. 11,000 people have died in the state of New York. But on the other hand, we also hear from the governor on a daily basis about how the trends are improving. Those are numbers. What are you seeing right now on the front line?
So at our hospital, we are seeing a slowdown in the number of patients coming to the emergency room. When I say slowdown, I mean a very small difference from day to day. But inside the hospital, we still have many, many critical patients. We're continuing to open critical care beds. We've opened another unit today. These are patients that require mechanical ventilation, require critical care support in order to survive. And unfortunately, there are still people that are not making it, and it's a day-to-day situation that we're in.
We hear all the time about supplies. How are you on PPE? How are you in terms of ventilators, bed capacity? How would you say all of those things are going at the hospital where you work?
So at the hospital where I work, we are continuing to increase the bed capacity for all of these critical patients. We do have a supply of ventilators, so that hasn't been an issue up to this point. Again, we do not know how long this is going to go on. As far as PPE, just like every other healthcare organization across the country, we are conserving the PPE because, again, we don't know when this is going to end. So we're reusing masks and our other PPE in order to conserve it. We've had good support from AFT, which is our national union, who's been supporting the nurses, as well as our local Federation of Nurses, UFT. We've been supporting the nurses with food, with support groups. We're in it for the long run. This is a long fight. And unfortunately, I don't see this ending anytime soon.
Yeah, that's an important perspective. And I think everybody knows this already from having followed this for so long. But, that's not normal, having to reuse masks. It's not even safe. And everybody agrees on that. But it's the situation that you guys are in. It's not your area of expertise, but I think sometimes we all get in, especially in a story like this, we try to cover it the best we can. But we're all in some sort of a bubble, I think, Howard, those of us who are not on the literal front lines. So our conversations here around the economy the last few days have been about, getting back at it, getting back to work, getting back to business. Do you have, from your own personal perspective, have anything you'd say to people getting a little frustrated right now, want to get back to their normal lives?
Look, the only thing as a healthcare professional that I'm going to say is that we must continue to social distance. We must follow healthcare professionals, the CDC guidelines. I don't see us getting back to work immediately. I'm so concerned that if we jump the gun too soon, that we're going to have an extension of this pandemic. I think following the government's recommendations of staying home, social distancing, the governor of New York's recommendation about wearing masks in public, I think we have no choice but to follow those guidelines, because if we don't, we're going to be in a far worse situation than we're currently in.
Right. The last thing anybody wants, of course, is to see, once you make some progress, as the governor himself has said, to see, that progress go in the other direction. Howard, stay safe, and thank you so much for the work you and your colleagues are doing, and thank you for updating us on it today. We appreciate you coming on.
Thank you. I appreciate the time.
Melissa.